Clinic on Wheels by Sarah, Sierrah, and Danny.
So what's the problem? The immigrant population is denied their basic healthcare needs. If the immigrant treatment in detention centers is any indication of how immigrant healthcare is going to be handled, then millions of people are in danger. They can't afford healthcare insurance. They're not given it due to the fact that they are not documented in the country. So they can't afford basic things like MRIs, doctor's visits, surgeries, and possible life-saving treatment. There are also many statistics to combat this problem. Immigrants and migrants are the most vulnerable group to this healthcare inequality. They can't afford hospital bills or to take proper care of themselves or their family, and their low incomes often make it difficult to acquire any form of health insurance. There's 100,000 persons to every 311 refugees in the United States, and this just means that it's going to keep growing, and this problem's only going to grow larger. And 14.5 million immigrants and their U.S.-born children under the age of 18 who lack health insurance combat for 31.9% of the uninsured population.
A mobile care center would be the most effective solution of reaching multiple areas and providing care for the most amount of people. We would tend to their physical needs with medical intervention using the volunteer healthcare workers. We would also be tending to their mind and soul, which is our job as nurses, by going so far as to educate and teach basic life-saving skills. We want to improve their quality of life by using our clinic and to better prepare them for any problems that they may interfere in their future. As another way to prevent future complications, there would also be a collection of materials such as hygiene products and first aid through donations. The materials would then be passed out at each of the designated stops to continue to provide our support and advocacy for the patients.
As future nurses, it's our privilege and responsibility to take care of all patients. Immigrant populations are among the most vulnerable populations in the world. They are often denied basic healthcare needs, and us as healthcare workers need to meet those needs. As Villanova students, we value Caritas, which relates to the idea that we care and love for everyone, regardless of where they come from or their citizenship status. To culminate all our identities, we are Villanova nursing students, and we hold both Augustinian values of Villanova and also the values of nurses.
The immigrant population is expansive, and while we would like to help everyone, we have chosen the states with the highest numbers in order to make the biggest impact. Especially with Texas and California being on the border, our resources would also be focused on them in order to provide aid to the most in need. Border conditions are horrific, and there are so many immigrants that are uncared for and never checked. Our goal is to minimize the population that is uneducated and suffer from any healthcare problems due to their conditions and/or situation. The market will never stop growing either, with the entrance of new immigrants into the country every day. There will always be a patient in need.